Hello, everyone. Good evening. Welcome to today's amazing edition. Oh, you're here with our well-being. This promises to be like extreme, deep, amazing, and beyond expectation. Yes. So I just want to be sure that you can see and you can hear me. Is this what we're having everywhere? Can you hear me? Can you see me? Is there a time lag in the things I'm saying? Please, can I get like feedback? Can I get feedback if you can hear me, if you can see me, so that we can move from this point? Do we have men on this live? Do we have men here? If you're a man, please share your reaction. Let's see all the men in the building so we can count you. And then we can carefully, know what we're saying. So, welcome again to our well-being and care. This is going to be you and us talking about all of the things that you need to know about the woman's body, the things you don't know about the woman's body. To think that I have been at an event with Dr. Shamsia. I'm telling you, this doctor is amazing, one of a kind. I've been at a meeting with her, an event actually, and at my old age, at my old age, there were things that came to light and I have not heard about. And from that meeting, I was able to um, tackle these things, and they really, really made a difference. So you want to take the opportunity right now to get your book, to get your book pad, your biro, your pen, get them ready so you can put your questions down. Don't wait till like the end of the show. Start now. Put your questions down so that you know what's going on, right? And then the things that appeal to you the most, drop them in the chat box, yeah, so that we know that you're following and that you can hear and you're fully participating. All right. And then if you have any complaint that you're feeling, just let us know. We have someone in the chat box that will attend to all of those things. So we will be starting with some introductions. I am Elizabeth and I am your host. And I'm so honored and privileged to be. You know, um, I'm always honored to be in a gathering that teaches. So let's get into it, right? Let's get into it. So I give you Dr. Shamsia to take it over from here. Thank you. Dr. Shamsia, can you hear me? Hello, guys. Can you hear me? Oh, wow. Thank you. Thank you. Oh, that's amazing. You can see and you can hear me. I know the network is really bad, but we will manage. So I was about to tell you guys that the topic today is menstrual disorder, and this is so common. As a matter of fact, some people have normalized menstrual. They said it's something that must happen to you if you're a woman. Some people have said offended Ogun. That's when you're having menstrual pain. Like so many things have gone on about the topic. But today, somebody said today, what we hear was going on with this old menstrual cycle. You get to find out, is it normal? Is it abnormal? Is there something else that can be done about it? Or is it something that you just chill with and manage for the rest of your life and wait for menopause to come? You know, today we'll get to know. So before I go further, I want to know, do we have men? Do we have men on this live? If we have men, I'd like you to drop us a comment. We want to count you. We want to count the men. Just drop I am a man. If we have men here. We don't we said men should come, but if you did come, we want to know that you're here. So, how many of us have ever had menstrual cramps? Have you ever experienced menstrual cramps? If you have, drop I have in the comments. Let's see, let's go. Have you ever experienced menstrual cramps? Like terrible pain, that one that hits at the waist, or do you have premenstrual cramps? Premenstrual things like pain and all of that. See, I'm here to learn like you, but this will help us address certain things. Now, if you have experience, because there will be an about, very, very special, that opportunity will be given for you to ask your questions. But when that opportunity is given, you want to be sure to take advantage of it and hit the nail on the head. Then you also get to learn what prolonged menstrual disorder can result into, right? It's very wrong for us to live in ignorance and expect that certain things will just happen by chance. Okay, so, oh, my sister, I can see you. I can see you. The network is crazy everywhere. It's crazy everywhere. Sorry, we'll manage. We'll manage. But this topic today, we'll touch it. We'll touch it. So, ladies, let's do something. I want you to do something for me right now. I want you to share the link with your friends. Share the link with ladies. Ladies, push the link to other ladies. Push it, push it, push it, push it. Let your ladies get this. This is juice. This is news. This is information, and it's free. We ladies, we like free things, Abby. Yeah, this is freebie. Let's go. Let's go. Let's go. So before, while we're at that, let me give you a gist about the first time I met Dr. Shamsia. I met her at an event where we're having to talk and about so many so many young girls. I were privileged to talk to so many young girls about the same menstrual cycle. We talk to them about health. We talk to them about confidence. We talk to them about a whole lot of things. And I'm telling you, it was life changing. So Dr. Shamsia knows how to drive the point home. So she's one you want to be sure to give attention to. And let me remind you, this is our well-being and care. This is the only first place you will get information on our well-being and care. The best place. You're not just getting information, you also get the opportunity to interact. Yes. Ladies, have you shared the link? Let's go. Share the link. Share the link. Share the link with another lady to add another lady to add another lady to tell a lady that a lady is telling 10 other ladies. Yeah. If it's someone's birthday, just send this to them. Say, Happy birthday, join this live now. If it's someone's birthday, just put this in a bundle and just send it. Hi, happy birthday. Oh yeah, join this live now. Let's go, guys. Let's go. If you can see and hear me, I would love your feedback. If you cannot, I would love your feedback. Thank you. I can see your feedbacks already. Thank you. Thank you. Oh yes, the network is kind of very like that today, but miraculously mine is stable. Ha, that's a surprise. Okay.
Hello, everyone. Can you hear me? Hello, can you hear me? All right. Hello, if you can hear me, kindly say I can hear you. Kindly use the chat box. If you can't hear me, can you hear me now? All right. Good evening, everyone. I can see that some people said they can hear me. It's good to have you. All right, we're going to get into the business of today. Thank you so much. I can't see my co presenter. Where is she? I just want to be sure that, okay. Oh, yeah, thank you so much. Thank you. All right, so I'll just be sharing my screen right away. It promises to be an interesting time. Please make use of the comment section, the chat box as much as possible. And then at the end of the presentation, I would love to hear from us our questions and where we need clarification. Yeah, so before we get into what we're discussing today, which is common menstrual disorders that affect us as women, I would really like to introduce myself. For those of you who are just meeting me for the first time, I am Dr. Shamsia. I am a women's health physiotherapist, and I'm happy to be speaking with you all tonight. I believe that we're going to be having an exciting time together. So I'll be sharing my screen right away. All right, so I believe you can see my screen. Please let me know if you can see my screen. Just say yes, I can. That's how I can see your screen. All right, so if you can see my screen, just say yes, I can see your screen. All right, thank you so much for the feedback. All right. So just like I said, today we are actually discussing on common menstrual disorders that affect women. So most times I like to talk with presentation screens so that you can actually relate, especially with pictures, and also get to understand the subject matter. So please, we're not in a lecture room. So that you take note of that very well and ensure you ask questions as much as possible at the end of our conversation. So today we'll do more like an introduction um to what we want to talk about. So, before we even talk about the disorders that actually affect women, when it comes to menstruation, I think it's very important that we actually, understand when it comes to menstruation, what menstruation actually is. Because I don't want to assume that everyone who joined this live stream actually understands what menstruation is, because we may have some teenagers who may not really be in the live stream now, but may want to go back and listen to this. So it's very important that we actually get it from the basis. So okay. Now, as a girl, there is what we call the start of menstruation or periods. So, the first menstruation that every lady actually experiences is what is known as the menarche. And the menarche usually occurs between the age of 8 to 15 years. And averagely, we say that a girl should be able to start menstruating at age 12. So, from the age of her first menstruation, a woman actually goes through a cycle every month until the time she gets to menopause, usually around 45 to 55 years. Some women actually start menopause from 40, and because of course now we know that lifestyle has changed and a lot of things have actually changed, so some women actually start menopause early. So that continuous outflow of blood that you see every month is actually your monthly cycle and what we call menstruation. So it will interest you to know that at birth, every girl is born with millions of eggs, unlike the men where they get to, have their sperm being reproduced every day, every now and then. But for the lady, for the girl, when you're being born at birth, you have millions of eggs, and these eggs do not produce, again throughout your lifetime. Instead, you shed these eggs. So every girl is born with approximately 2 million eggs in her ovaries. And it's interesting to know that about 11,000 of them die every month before the age of puberty. And at puberty, a woman has only 300,000 to 400,000 eggs remaining. And from that point, you begin to lose, thousands of eggs, and then every month you actually shed these eggs. So you can see that as ladies, you should not play with the number of eggs you have, because every month goes, as that blood is being shed, if you don't get pregnant, you are actually losing eggs. And your eggs is what gives you the potential to actually conceive and eventually have a child. So before we, like I said earlier, before we actually go into some of the problems, the common problems that women face when it comes to menstruation, what is menstruation really? So it's the monthly hormonal cycle that is being experienced by a woman. And just like I said, this cycle, when it comes, it actually involves the release of an egg from the ovaries through the process of ovulation that prepares the uterus for either pregnancy or the shedding of the blood of the uterus, right? Which comes out as blood, which we all know as menstruation. So it's either the egg is being fertilized during your ovulation period and leads to pregnancy, or that egg is being shed and actually comes out as blood, which we know as menstruation. So it is also known as, some people call it menses, some people call it menstrual period, some people call it menstrual cycle. So it's very important that we know this. And it's very interesting to know that this menstrual blood is not just blood. Do you understand? It comes with tissues, it comes with a mix of tissue and blood. So it's not just the blood itself. So it flows from your womb down to your cervix and then eventually out of your vagina. So, excuse me. So now, when you start experiencing menstruation as a girl, of course, during your age of puberty, there's what we now call menstrual cycle. Now, your menstrual cycle is the monthly, series of the natural changes in the hormone production and the structures of the uterus and the ovaries that prepares your body for the possibility of pregnancy. Now, what's that menstrual cycle? We have what we call the cycle length. So the cycle length is from the first day you see your period to the last day before you see your next period. I hope I'm communicating and you all can hear me. Please, at any point you can hear me, make use of the chat box and let me know that you cannot hear me. Thank you so much. Yes, so the cycle length is actually the first day that you see your period to the last day before you see your next period. And this normal cycle length is supposed to be a period of 21 days to 35 days. That's the period between when you see your first, as in your first period, to the last day before the next period. For example, today is the 20th of February. If as a girl or as a lady you see your menstruation today, and then the next time you'll be seeing your menstruation maybe on the 15th of March. So 14th of March, so between 20th February to 14th of March is actually your cycle length. So please, I want us to establish that. So, and the normal cycle length is actually between 21 to 35 days. And an irregular cycle length is when your cycle comes before 21 days or 35 days. So you can see that some ladies can have their menstruation maybe today, this month they're having it on the 20th, next month they're having it on the 18th, the other month they're having it on the 13th, but it's still within the period of 21 to 35 days. It's actually a normal menstrual cycle length. It's regular. It's irregular when maybe this month your cycle length is 18 days, next month is 30 days, the other month. Do you understand? So it's very important that we understand this. So far your menstruation falls between 21 to 35 days, then it is actually normal. And the average cycle length for every woman is 29 days. So what now do we consider as an irregular period? Periods that occur fewer than 21 days or more than 35 days. I'd already said that. If you miss your period 3 or more times in a row, maybe this month you don't see your period, next month you don't see your period, another month you don't see your period, that's a call for concern. You're actually having an irregular period as a lady. Then the flow of the blood, if the flow of the blood, if your bleeding is much heavier or is lighter than usual, then is a call for concern. So you don't want your blood to be too heavy, and you also don't want it to be too light, then you're actually having an irregular period. So if your period lasts longer than 7 days, is also an irregular period. So I'm giving us the synopsis so that we'll begin to have an idea. Oh, so does that mean that if I'm experiencing A, B, and C, oh, my period is irregular, or if I'm experiencing this, my period is actually normal. So, and that's why I'm giving us this. So the length of time between your cycle, if it varies more than 9 days, do you understand? Maybe, for example, one cycle is 28 days, the next one is 37 days, and the next 29 days. It's irregular. So you need to take note of that. If your period is coming with severe pain, you are always having such excruciating pain, there is so much cramps. In fact, you can't go to school, you can't go to work, you can't do activities that you will normally do on a daily basis just because of your menstruation, then it's a call for concern. You're actually having an irregular period and there's a problem somewhere. So, or if your period comes with vomiting, you're vomiting excessively, it's not a good sign. Or maybe if you soak one or more sanitary pads, you understand, some of us use pads, some of us use tampons, depending on what you use. And if that sanitary pad is actually soaked, for within an hour, your sanitary pad is so soaked, like you can't even wear it anymore. Just within 1 hour, less than 1 hour, then is actually a call for concern. So we have different phases of menstrual cycle. I wouldn't want us to go into that. We have the first phase, which is normally lasts between the first 3 to 7 days. We have the second phase, we call it the follicular phase. We have the third phase, which is the ovulation phase. And this is a very important part, a very important phase of a woman's menstrual cycle, because it actually occurs in the middle cycle, and this is when the eggs actually get matured by one of the ovaries. So around the middle of your menstrual cycle, we have one of the dominant follicle will actually release a mature egg from the ovary, and this egg travels down. It will go down to the fallopian tube and which can now be fertilized by a sperm, or that will now eventually lead to pregnancy. Or if you engage in an unprotected sex, you will actually get pregnant. But if you do not, then it will now shed out as menstruation. So it's very important. I'm sure on our subsequent sessions, we talk about more about, ovulation, how to actually calculate your safe days, how to actually know your fertile days, and what have you. So we also have the fourth phase of the cycle, which is the luteal phase. So we need to go into our discussion for today, which is actually the menstrual disorder. So I hope that, this has actually given us like a background of really what menstruation is. Like I said, for the sake of our girlies, maybe we have teenagers who will get to watch this later. They might just be able to understand the subject matter. So it's so interesting to know that 14 to 25%, 14 to 25% of women of childbearing age actually experience menstrual problems. So we can see that it's actually a problem. Like, a lot of women have been told that, it's good for you to be a woman. What makes you strong? It's how much you can endure pain. No, these things are common, but they are not normal. So if your menses is heavier than normal, like I said, you're soaking a pad within 1 hour, it's not normal. If it's very light, if it's very scanty, it's not normal. If it's longer or shorter than 21 or 35 days, is not normal. So we have different kinds of menstrual disorders. And then the first one we're going to be talking about is what we call the premenstrual syndrome. Now, this premenstrual syndrome is actually different symptoms that comes up, mostly a week before your menstruation. So in this situation, the menstruation hasn't actually started, but before it starts, you understand, you experience these problems, like this discomfort, like your breast becomes tender, swelling, you begin to have like diarrhea, you're always frequenting the toilet, your tummy, you're having this excruciating pain, headaches, back pain, your mood is you just can't regulate your mood, you're getting excessively angry, or maybe you're excessively excited, you're having experiencing fatigue, or breakout of pimples or acne on your face. All of these are not normal. This is what we call premenstrual syndrome. And it usually starts at least 13 days, day 13 in your cycle. And normally it resolves, maybe 4 days before your actual menstruation start. So this is like pain before the action, right? So some people's own actually come while they're actually menstruating, but some come before they even start the menstruation. And in such a case, you are actually experiencing premenstrual symptoms, right? So we have what we call amenorrhea. Amenorrhea is a very common menstrual disorder that affects a lot of women, and simply it means absence of menstruation. Absence of menstruation, that is when a woman misses her period for more than 3 menstrual cycles. That's like you've not seen your period in 30 days, 60 days, 90 days, and you're not pregnant, you're not breastfeeding, you're not yet in your menopausal age, or that's you're not between 45 to 55. Like I said, some women actually start menopause at age 40. So you're actually having an absence of menstruation, and usually this is usually seen in younger ladies. Usually, if a lady is about 15 or 16 and she has not started menstruating, is a problem. She needs to seek medical attention. She needs to go to her doctor for her to be checked, because ideally by 12 a lady should start menstruating. However, this varies amongst ladies. So if at age 15 or 16 your teenage girl has not started menstruating, please ensure you take her to the hospital to be medically examined by her doctor, so that her problem will actually be addressed. So in that case, the child or the girl is actually experiencing absent menstruation. So there are actually two categories. We have the primary absence of menstruation and we have the secondary absence of menstruation. So the primary absence of menstruation occurs when a girl does not begin to menstruate, just like I said, by age 15, 16. You understand? And so because of that, she needs to actually seek medical attention. And it could actually be as a result of different factors, which can actually cause it. So it could be that she's having maybe an eating disorder, maybe she's taking a kind of drug or something. And then in older adults who experience this absence menstruation and who have not actually started menopause, it could be that they are setting drugs that they are taking, like antidepressants, like BP drugs, and what have you. So it's very important to actually check that. So we have the secondary amenorrhea. So the secondary amenorrhea actually occurs when periods that were previously regular, like you as a girl, as a lady, you used to have regular period, but suddenly your period just stopped. at least 3 months or more after your menstruation has started, like you've been having your normal menstruation, and then all of a sudden your menstruation just stopped flowing, then it's possible that you are actually experiencing absent menstruation. And don't forget that I said that it has to be up to 3 months that you haven't seen your menstruation. Then you know that, oh, this is actually a problem, and I need to actually seek medical attention. So, and this is usually associated with stress. As a lady, if you're stressed, if you're having so much stress, if you're having weight loss problems, like you're just losing weight excessively, and then you are having some issues that have to do with your thyroid, and all of that, or maybe you've even had surgeries that have to do with removing your ovaries and all of that. So it's usually common among such women. So, if you're a lady here or a woman who is undergoing such a problem, just know that you actually need help. It's not normal. So, this type of common menstrual disorder that women actually face is what we call oligomenorrhea. And in oligomenorrhea is when your menstruation is infrequent, is not frequent. So, is when your period actually occur more than 30 days apart. Remember, we said that the normal cycle length is between 21 to 35 days. So if your normal cycle, if you usually experience maybe your cycle after 35 days, then there is a problem. Light or scanty flow is also common, right? Of course, we know in the first years when a woman or a girl starts menstruating, and even before menopause. But when you first menstruate, that's normal, right? And then you might just see that when a girl starts menstruating, like maybe a 12 years old teenage girl now, she starts menstruating. The next month, she may not actually see blood. Another month, she may see. You understand? So it actually fluctuates, but it comes to a point of normalcy. But in a situation whereby you've had your menstruation is now normal. January you see your menstruation, February you see your menstruation, March you see your menstruation, and then suddenly in April you don't see. In May you don't see. Then in June it shows up. Then there's actually a problem. So you're actually having infrequent menstruation, and it's something that you have to go to the hospital to be checked. So normally, what causes your menstruation to be infrequent? It could be as a result of hormonal imbalance. There are some women that actually have what we call PCOS. You understand, polycystic ovarian syndrome. It's very common among women. So it's something that actually can affect your menstrual cycle. When you have diabetes as a woman, when you have some, pelvic inflammatory disease, and when you have some kind of eating disorders, especially for younger adults, it can actually lead to you having this infrequent menstruation. So your menstruation will just be fluctuating. Today, this month you see, the next month you don't see. So in such a situation, ensure that you actually seek the right medical care. So we have what we call dysmenorrhea. Dysmenorrhea is another type of menstrual disorder that is common among women, which of course can be primary and secondary. So dysmenorrhea is when you have frequent cramping during your menstruation. Remember, I talked about the premenstrual syndrome, where you actually have the symptoms, the pain usually comes before the menstruation, right? But in the case of dysmenorrhea, it actually comes during the menstruation. Your menstruation has started, you start seeing blood, but it's usually associated with serious and very severe pains. And sometimes this pain can even spread to your lower back, to your thighs, you understand? And it usually causes a lot of discomfort for you as a lady. So this dysmenorrhea, which is painful period, you can just call it painful period actually. So it can be primary, it can be secondary, right? So, and usually this primary dysmenorrhea is the pain that comes when you know that for that blood to actually come out from through your vagina, you understand, it's your uterus will actually have to contract. There's some we call it uterine contractions. Uterine contractions are like when your womb, another name for the uterus is your womb. So there are some contractions that are going on inside. So those contractions will actually lead to what? Cramping, will lead to the pain, will lead to you having heavy bleeding. You understand? So in this period, you will realize that you are actually having pain that is accompanied with your bleeding, which is not normal, right? Is excessively. Have had to treat women who actually have I've had to treat women who actually experience so much pain, you understand, and they can't even stand, they can't work, until medication or appropriate therapy is being given to them, right? So this is the primary dysmenorrhea, right? And then the secondary dysmenorrhea, that's the pain that actually comes because you have a medical condition, usually like fibroids. Fibroids is another thing that women usually suffer from a lot. So you could have something like endometriosis. When you have such conditions, it actually makes your menstruation a tug of war. It makes it a tug of war and a usually painful experience for most women. So in that case, you are actually having what we call secondary dysmenorrhea. Then we have what we call menorrhagia. Menorrhagia is heavy bleeding, right? So menorrhagia is actually abnormal heavy periods. You see that dysmenorrhea is painful, abnormal, painful periods. But menorrhagia is heavy bleeding. It is characterized by prolonged heavy bleeding. You understand? You're just having so much bleeding. And during a normal menstrual cycle, as a woman, average, you're supposed to lose about 30 mils of blood, right? And change your sanitary pad like maybe 5 times in a day. But for someone who has heavy bleeding, you're going to be changing your pad like almost every hour. In fact, almost every 30 minutes, right? And then you realize that you've changed about maybe 15 times in a day. So you're actually experiencing abnormally heavy bleeding. And this is actually a call for concern if you're experiencing such a problem. So, and there are different things that can actually cause it as a woman. If you have fibroids, if you're having what we call maybe a hormonal imbalance, you're having some kind of infections, you're using some birth control pills like IUDs, right? It can actually impact on your menstruation, and you can actually have excessively heavy bleeding. So, another type of common disorder that a woman can actually experience is metorrhagia. Metorrhagia is a type of menorrhagia, right? So it's when your bleeding is irregular, especially if it's between regular menstrual cycles. So it occurs in unpredictable amounts and intervals. And bleeding is either unrelated or to periods, right? Like it's not your period, but you're just bleeding, you're just seeing blood, right? It's not your ovulation, it's not your bleeding, like it's not your normal cycle time, it's not time for your menstruation, and then you're just seeing blood. Then it's actually a call for concern, and you should actually seek for medical help. So we have polymenorrhea. Polymenorrhea is also a type of disorder, right, that women face more when you have more frequent periods than normal, right? When your period is actually frequent, maybe you're having period like twice in a month. We have situations whereby young ladies actually have their menstruation coming such a case, you need to also seek for medical help. And sometimes it could be as a result of stress. It could be some specific drugs that you're taking. It could be some fibroids that you're having internally. So you need to actually check what's happening so that you can be given the appropriate medication. Then we have the hypomenorrhea. Hypomenorrhea, this one, we've been talking about heavy, we've been talking about prolonged, and all of that, excess of it. But in this time, we're actually talking about very little bleeding. So hypo, right, is when your bleeding is very light and it just lasts for like 2 days. I mean, there are some people, the normal days you're supposed to menstruate is about 3 to 7 days. But if you're menstruating for like 2 days, then it's actually a problem. And then sometimes it could be as a result of, maybe stress, maybe you're depressed, maybe you have the fat in your body is very low, you are having some adhesion, some scar tissues in your womb, your uterus, you need to actually seek help, right? Then we have the hypermenorrhea. Also, this is another disorder that can actually affect a woman, and is as a result, it refers to frequent, very excessive bleeding and heavy when you're having very heavy menstrual cycles over 90 mils of a cycle of normal duration, right? But this is actually linked to maybe when you're having issues like liver disease, you're having some abnormalities, you're having some hormonal disorders, it can actually affect you. So, um, we have actually come to the end of discussing the different kinds of disorders that can actually affect a woman. And I'm sure that in our next session we'll be able to talk about how those disorders can be managed, because it's one thing to know that you have a problem, and of course it's another thing to know that, oh, there is actually a solution to this problem. So I would like to us to interact with the chat. If you have any questions, if you want to seek any clarification, if you can still hear me, and then I'll be taking questions now. I don't know, can anyone hear me? Can you hear me? All right, I'll stop sharing my screen. If you have a question, I'll be taking your questions. Please put it in the chat box. I hope it was not too medical. This is our first session. I'm sure we'll keep getting better. The essence why we're streaming it here is for us to reach wider audience, to actually reach more women, so that they can learn and actually know what's going on in their bodies. So, does any of the menstrual disorders actually speak to you as a woman? Today, we're not actually talking about how these disorders can actually be cured. So it's just like an awareness, so that, oh, this is actually a problem. If I'm having an excessively, heavy period, if my period is too light, if my period is too if it's painful, even before the menstruation, it's actually a problem. So I'm sure that we are more informed. We know that there's actually an issue when you're experiencing any of those conditions. And I hope it was not too medical. I would like to hear your feedback. Please interact with the comment section. Can you still hear me? If you can hear me, I'll just like you to respond. Thank you. Oh, thank you. Thank you. Chala. Chal Chalia. Thank you so much. Awesome. Awesome. All right. Thank you. Do you have any questions? You can just put it on the chat box and I'll be taking your questions. Our time is almost over and up already. All right. So if you have any question, you can still put it on the chat box. And then I'll be responding to your questions. Thank you, everyone. Thank you so much for joining in for the session tonight. And we're going to be okay. Thank you. All right. Abigail said, thank you so much for the knowledge, ma. I really learned a lot. Wow. I'm glad you did. And ensure you don't miss the next session so that you can actually learn how to manage these conditions, because like I said, it's one thing for us to know those menstrual conditions that women actually face, is another thing to actually know what can be done, right? So next on our next session, we're going to be actually talking about practical ways in which if you're having any of these menstrual disorders, how physiotherapy can actually help, you know, and make you experience a better womanhood. It's so beautiful to be a woman, you know. So, and I'm glad I'm a woman. Who else is glad she's a woman? Oh, thank you so much, Florence. Florence says, thank you so much. I have learned a lot. Wow, I'm glad. Please, sorry for the network itches. This is our first live stream. I'm sure that subsequently it's going to get better. So we could actually share the links with our friends, with our sisters, and so that we can take this knowledge, far. An informed woman is a powerful woman. So as a woman, if you have knowledge, about your health, you know, it's very important because you will take informed decisions. You will make informed decisions, and that's very important. Information is power, and when you have the right information, you know the right things to do, you know the right things, you know what to prevent, you know what not to do, what to do, and you see that you just have a very seamless womanhood. All right. Yes. Yeah. 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 Abigail says she's glad she's a woman. Yeah. We're in the same team. Yeah. I'm glad that everyone who joined is actually excited to be a woman. And it's such a blessing to be a woman, truly. All right, ladies. In the absence of any questions, um, I'd like to say thank you to everyone who took out time to join the live stream tonight. And we're glad with what we're doing through the Her Wellbeing and Care platform. Please, if you have not subscribed to our channel, please ensure to subscribe to our channel. And every Friday evenings by 7 p.m., we do meet here live to discuss issues that relates to us as women. And I believe that your life will not remain the same again as you continually show up and learn all that you need to know about your health. All right. Okay. All right. Thank you so much for joining in, and see you in our next stream. Thank you. Thank you. Bye, everyone.